How do you tell the difference between an ordinary rambunctious kid and one who has ADHD? And what do you do about it? Find out right now on Keeping Kids Healthy. Hello, I'm Dr. Winnie King, and I'm here with some experts on attention deficit hyperactivity disorder in the lobby of the Children's Hospital in Montefiore in New York City. So you may hear some noise in the background. That's all part of the environment. See if any of this sounds familiar. Your daughter's teacher suggests that she should get some psychological testing because she's too disruptive. Or your preschooler seems even more boisterous than his friends. Or your well-behaved, intelligent child is labeled lazy because she can't seem to keep up with her classmates. Well, it could be ADHD, attention deficit hyperactivity disorder. Many people still believe that ADHD isn't a real diagnosis, or that it's the fault of the parent, or that the child is just out of control. But it's not that simple. ADHD is real, and today we'll help you figure out when a kid has it and what to do about it. Here's a young man who can help us do that, and as you'll see, he even shot some of the video himself.
Good. I'm Jonathan O'Brien. I'm gonna be videotaping myself doing my homework assignments. I really don't want to do this, but I am trying. Like I always do, I really am trying, but failing miserably.
He was exceptionally rambunctious, very curious, moved around a lot.
Right now, I'm really thirsty, so I'm gonna get some water.
The teachers would say things like, he's getting up and walking around. He's just blurting out answers. He's not finishing the task in the set amount of time. They kept saying, oh, he's very smart, but he can't sit still. Towards the end of first grade, he was formally diagnosed with ADHD.
You'll be playing a sport with some of your friends, and everyone else will be completely tired, flopping over on the floor, dying for air, and you're also standing up there going, let's play, I want to play, run my bike, let's go work. So it's like having an Energizer bunny in you.
So he's in second grade, and then the principal had said that he's not doing well in class and that he either needs to be treated somehow or he has to leave. And I was completely devastated. And he's potentially going to be expelled in second grade. No, couldn't have that. And that's when I went back to NYU to say, help, I need it.
Sometimes what I do to help me concentrate is to chew on something. I don't know why it helps so much. So to help me, I'm going to chew on this, a pen cap. You'll just be talking to your friends, and then you'll just look at them, and then you'll shout this meaningless phrase, yourself, wah, or something. Just something compulsive, just make up. You feel like you really shouldn't have done that. You should have just kept your mouth shut.
The reason why I seriously considered the medicine and had him on it was for him to function at school more so than at home.
Oh!
And taking the tablet makes it a little bit easier for him to control himself.
Energizer buddy doesn't leave. He keeps running, doesn't stop. It's just that sometimes he's toned down. That's with my tablet. But if I don't take it, he's super energized.
A night and day difference. He was sitting still. He was on task. He was more compliant with requests. You know, he still had his bounciness, but it was more, he was more in control of himself than before.
Dang it, it's late. Okay, I now have what's going to take me a little while, you know. I now have to do basically an essay. It's hard funneling all this energy into writing because it doesn't take that much energy to write. But I digress.
Jonathan, I hear that you get straight A's in school. Do you always have that much trouble concentrating?
More often than not, I will. Whenever I try to do an assignment, it's difficult to get started on an assignment But once you get into it, you can really focus on it and stay on task. But the difficult part is just getting it started, because you really don't want to do it. It's like doing homework or going to work. No one wants to do it, but they have to.
That's true. That's very true. Boy, such wise words from you. Trish, how have you had to adjust to Jonathan's ADHD?
Well, the first thing I did was educate myself as to this disorder. I identified many of the characteristics in myself, looked back on the things that I did growing up to cope with those things, and I'm trying to teach him the same skills.
Yeah. Well, I want you to meet Dr. Kelly Posner. She's a psychologist from Columbia who specializes in diagnosing ADHD, and also specializing in ADHD is Dr. Jeffrey Newcorn from the Mount Sinai School of Medicine. And also with us is Dr. Howard Abakoff, the director of the Institute for Attention Deficit Hyperactivity at NYU. And Kelly, when is a child just being a kid? And when is it ADHD?
Well, ADHD is a disorder that involves severe difficulties with hyperactivity, inattention, and impulsivity. So somebody who has ADHD, a child with ADHD, will have many problems or symptoms in any or all of these areas. And very importantly, these problems affect their lives in many different areas: school, home, peer relationships, even their physical safety.
Now there's 3 types, right?
Yes.
Okay, go through the types.
Yes, some kids have problems just with inattention, and that the inattention causes difficulties in all areas of their life. Some kids have problems just with hyperactivity and impulsivity. That's called the hyperactive impulsive type. And some kids have problems with both inattention and hyperactivity, and that's called the combined type.
Jeff, do we know what causes it? Is there something different going on in the brain?
There's been a lot of research in this area. We know that there are certain key areas of the brain that seem to perform differently in individuals with ADHD than people without the condition. Areas related to inhibitory control, or being able to put the brakes on, or executive function, making decisions, planning out certain tasks and activities. Problems that we frequently see in individuals with the condition. We also know that ADHD is highly heritable. It is frequently transmitted within families, although genetics don't account for all of ADHD.
Well, Howard, it seems like a lot of people are of the impression that this is overdiagnosed, or that it really doesn't exist at all. Why is that?
Well, you know, a lot of children show these problems with overactivity, impulsivity, and inattention. So the assumption is these are just children that do it more so than other kids, and it's not a disorder. Unfortunately, that's just not true. These are children who are really struggling with the problems associated with this disorder, and we've gotten very good right now at being able to identify children who have it and children who don't.
Well, if it is truly a disorder, a real disorder, does that mean that we should or should not hold children accountable for their behaviors?
We should not. It's not that the children are being willful or purposeful. They may have good days and bad days. In fact, that's one of the hallmarks of the disorder. So parents think, well, if he can do it one day, he must be able to do it the other times. That's not so. Many of the children, in fact, struggle with this and wish that they could get better control of these problems.
Well, Kelly, this is your big thing, making the diagnosis. How do you do that?
To make the diagnosis, you need to assess all of these different problems and symptoms across many areas of a child's life. Again, how does it affect home, school, peer functioning, etc.? And quite importantly, it's very important to talk to different sources of it, to get different sources of information, talking to a teacher as well as a parent, so you can have different pictures about how it affects their life. It needs to be diagnosed and seen before age 7. As well as all these other things.
So are you looking for a consistent pattern of behavior?
Yes. These behaviors have to present themselves frequently and often, and to a certain severity level, and over an extended period of time, as opposed to just a snapshot or a moment in a child's life.
And Jeff, what are some other disorders that could be confused with ADHD?
It turns out that almost any of the psychiatric disorders have some symptoms that might overlap with ADHD. Depression, anxiety disorders, conduct problems, bipolar disorders, all of these have certain features that might be seen as overlapping with ADHD. Of course, at the same time, many of these conditions can occur along with ADHD. So these same conditions that we're trying to distinguish from ADHD can occur simultaneously.
Yeah. Kelly, what's the harm in missing the diagnosis of ADHD, or maybe misdiagnosing it and calling it, say, bipolar disease?
Well, we know that ADHD isn't appropriately treated and identified, that a lot of negative consequences can happen, starting with really impacting a child's self-esteem. They struggle and they don't know why they're having such difficulty, which then can lead to depression and anxiety. And in fact, later on into adolescence, some of the hallmark symptoms involve impulsivity. And if you don't treat that, that can lead to impulsive behaviors like drug abuse, actually increased car accidents, and pretty damaging consequences.
So it's really important that the diagnosis be made by an expert.
Yes, absolutely. Somebody who's trained in understanding how to look at all these different types of symptoms and how they affect all these different areas.
And this
of
is
a
especially
child's
important before going on medication, because any doctor can prescribe medication, but a specialist should be involved in the diagnosis before the medicine is started.
Yes, a comprehensive evaluation is critical.
Okay. You know, since it's easier to miss ADHD if the child doesn't have that hyperactive component, we decided to visit one boy and his little sister who can help us see the difference. But first, a little humor.
How many kids with ADD does it take to screw in a light bulb? Hey, wanna go ride bikes? I'll look up classes over and I'll look down at my page and I have maybe 1 or 2 sentences written, and all the other kids have 3 or 4 paragraphs. And it's pretty annoying.
I've noticed Ben was struggling at school at an early age. It was very troublesome to have this young boy who was very smart have so many problems. The teacher would come to us and say he's very smart, but is having trouble keeping up with the class.
I have ADHD, but I do not feel hyperactive at all because I can sit in my chair. I do not have a big problem in school with my behavior. According to my friends, I'm a goody two-shoes. And since I'm a good kid, they expect me to try and do well, which I try to, but I sometimes fall behind, which the teachers don't expect.
We would always say, you're slacking off, what are you doing? And come to find out it's part of this disease, that they don't mean to do that.
The teachers, I guess they deal with some hyperactive kids, but I don't think they really know how to deal with the kids that aren't hyperactive. They'll just think I don't know the answer or I don't want to do my work, which I do.
We took him to a neurologist. He diagnosed him with ADD at the time, but it took all those years, pre-K and then all the way up to 4th grade, to finally get that gone.
Not ready.
My daughter Ashley has been diagnosed with ADHD. A lot of the issues I have with Ashley is the fidgetiness and the constant talking. She doesn't think a lot before she moves, but that's her ADHD. It's amazing how different they are, how one is so serene and the other one's so bouncy and full of life. When a child has hyperactivity, you can see it. It's right there. It's right out front. You know, you're wiggling or you're sitting there fidgeting your fingers. Where when you have a child like my older son Benjamin, who's an easygoing kid, that child is not looked at the same. They look at him like, oh, when you don't do your work, you're slacking. That child usually is looked over and just passed on from grade to grade.
Jonathan, how different is Ben's situation from what you went through?
Ben appears to be a much more relaxed child, less hyperactive than me. He appears to be laid back, and also I can concentrate on my work if I have to. I can really focus on my work.
But let's talk about treatment. Let's move on, Howard, and talk about the accepted standard treatments for ADHD.
Well, the first-line treatment remains medication, and there are stimulant treatments and some newer non-stimulant treatments. But in addition to that, there's a lot of work that's been done with behavioral treatments, and that involves working closely not only with the child, but even more so with the parents and the teachers. And for parents, it means teaching them parent management techniques. For teachers, we try to help them provide structure in the classroom and learn classroom management techniques for teaching and managing a child with ADHD.
Well, Jeff, as the medical doctor, you're the one who actually prescribes these medications. And so I know you've heard, and there's some parents that have some concerns about medication, especially when it comes to giving a medication to a child. And one of their concerns are side effects. What are the side effects that a parent should know about with these medications?
Well, these medications are generally effective in reducing symptoms of the disorder and some of the associated impairments that Kelly spoke about earlier. It turns out that most of the medications are reasonably safe, and many of the side effects that people would experience are nuisance side effects. For example, problems with decreased appetite, problems with having trouble going to sleep at night, or problems being too sleepy, increased pulse or blood pressure. Some of these, of course, can reach a proportion which would be problematic and which would require intervention or going off the treatment. Most can be managed safely. Many times the experience of side effects is quite minimal.
Well, what about parents who say, we've tried the medication route and it just didn't work for us?
Well, there are a lot of ways of approaching that problem. For one thing, it's important to understand whether the medication was given properly and dosed correctly. We know that many times when you hear this situation and you get into a careful history of what was given, the medication will not have been dosed properly. In addition, there's no single medication that works well for everybody. And particularly with ADHD, which there seem to be so many different types of ADHD, it stands to reason that different medications would be useful in treating different types of people. Yeah. So the take-home message is that if you haven't had a good response to medication, make sure that it's been given properly. If it has been given properly, there are several available medications or different formulations of those medications, and sometimes if you don't respond to one, you'll have a very good response to another.
And just briefly, some parents have some concerns about the concept of using a drug to treat a problem. They're worried that they're teaching their children that medications are the solution to all problems. Is that a valid concern?
Well, it's certainly reasonable to ask the question, and it's certainly important to communicate that medication is not the only way to help this condition. There is a set of skills that need to be developed, and that's very helpful to people with a disorder. On the other hand, it seems not to be the case that most kids with ADHD think that the medication accounts for all of the improvements that they've experienced.
Sure.
They are able to take credit for what it is they achieve, and it's important to tell them that they're the ones who are achieving their own successes.
Yeah. Trish, were you worried about giving medications to Jonathan?
Extremely. At the time, he was in 2nd grade, so he was about 7 years old. And this is very powerful medication, if you will, and I was not comfortable with that. However, I came across the NYU Child Study Center, and they were doing a study on Adderall, and not only was he being monitored from a psychological point of view, but also medically, where every 3 to 6 months he was being monitored with an EKG, he had blood drawn, and I had those results sent over to my pediatrician. So his pediatrician was looking at the results as well, and that went on for 2 years, so he was very carefully monitored.
And Jonathan, how do you feel about taking medication?
It's kind of like something that's necessary. I mean, you don't have to take it, but it does help you. It's kind of like breakfast. You don't need to have breakfast, but it helps if you have it. It's the same thing with the medicine. You don't really need to take the medicine in order to have a good day, but it does help you to have an excellent day.
You have such great analogies. I love that. You know,
Thank
Kelly,
you.
What about the issue of medicating preschoolers?
Well, we know it's an important question because actually doctors across the country are prescribing these stimulants to very young children. So answering the question about what their risks and benefits are and how safe and effective they are is of critical importance. Having said that, we actually have the first large study to look at how safe and effective these medications are in preschoolers has just been finished, and it showed that it's relatively safe and effective, consistent with what we see in older kids. Now, we also know from recent research that it's a very common problem, and kids at this very young age, it's estimated that up to 6% of the population may have this disorder at such an early stage. It all comes down to balancing risks and benefits, and the fact is when we see this at a severe level in these very young children, it can involve multiple broken bones, physical injury, and even life-threatening behaviors. So all of that needs to be taken into account when deciding on.
Well, Howard, what are some of the other ways to treat ADHD besides using medications?
Yes, there are, as I mentioned before, there are behavioral treatments that are used. Some of it is done directly with the child. So, for example, a lot of ADHD children have particular deficits in certain skills. They don't organize their time well, they don't organize their materials or plan well, and we can use behavioral approaches to help them learn those skills, but we do engage the parents and the teachers in assisting the child in whatever it is that we're working on. And that becomes critical as we begin to do what we call clinical behavior therapy. And that's where parents and teachers play an absolutely key role.
Well, how do you train the parents? What training do they get?
We need to let them understand how they respond to their child has an impact on what their child does or doesn't do. So we teach them how to use praise appropriately and what to look for that's positive and not only the negative. We let them know how to reinforce their child with things that are important for them when they meet certain goals that the parent sets at home. We do the same thing with teachers. We'll ask them what particular problems a child is having in the classroom. Ask them to monitor that. Give the information back to mom each day on what we call a daily report card. Mom uses that information to provide some reinforcements and reward at home for the child meeting those goals.
Well, let's go through some specific examples. Now, first of all, putting materials always in the same place. What are some of the other things that we can do?
Yes, you know, ADHD children tend to lose things or can't find them. So one of the things we'll ask mom to do is to label drawers, whether it's a drawer with clothing or a drawer with materials, so the child knows where to put something and where to find it when they need to locate something. Using positive feedback is very important. Catch the child being good. It's also very important to help structure the child's time so that he knows what should be done in what order each day and what to expect so that it gives them a better opportunity to plan their time. The other thing a parent can do is to make sure that they don't make their comments or requests to the child too complicated. Giving short, succinct requests, perhaps one or two at the most, makes it easier for a child, especially someone who has difficulty attending for long periods of time.
I see Trish is nodding her head in agreement. Okay, so let's see how Jonathan and his mom, Trish, practice these ideas when they're at home.
As a parent, I learned what I bring to this situation. I learned that I have many of the same traits that he has, how scattered I can be sometimes, and how I'm not always clear with my instructions. So I would label his drawers. I have labels in his closet, so he doesn't have to think too much as to where do I go for this? How do I put this away?
When you have everything labeled out for you and set in steps, you don't have room to think. If you have a path set for you, you can only go on that path. You can't go anywhere else.
So I have to give him very clear, specific directions. I can't give him too many at one time. When he was learning how to do his laundry, I couldn't just, do this, and that. I had to walk him through it. This is step 1, this is step 2, step 3. And we did that for a good 2 or 3 months until he learned the steps. I couldn't verbally give him those directions. I had to physically go down there and show him how to do that and watch him. And I kept the bleach far away.
So it sounds, Howard, like the 2 most important points for parents to remember is to give lots of feedback and lots of structure.
Yes, I think that's right.
Yeah. Well, we've talked about the traditional accepted treatments, but there are some alternative therapies, proven or not, that parents are trying. And I decided to find out more about them.
The alternative therapies we found to be most helpful here are nutritional manipulation and supplements.
Some children with ADHD are sensitive to certain foods that can trigger hyperactivity in the nervous system. So avoiding foods like those that contain gluten, dairy products, nuts, citrus, and soy may make a difference. Dietary supplements can also be helpful.
I want to stress that when we use alternative therapies in kids with ADHD, we do it in the context of an integrated approach. This means that the right type of behavioral therapy, the right classroom environment, the right type of intervention for the family all have to be in place.
Another treatment for ADHD that has been proven to work for other disorders like epilepsy is neurofeedback. So what are we seeing on the screen?
Andrew's playing a regular computer game, except that it's attached to his brainwave patterns. And it requires him to keep his brain waves in an attention mode, and that makes Andrew's brain exercise itself, which helps the brain grow and develop. It helps develop his ability to focus and be still and to pay attention.
When a child's playing this game, how does the computer tell the child that they're off track, that they need to change the way they're thinking?
When they start to fade out, the game pauses. They increase their level of attention, which turns those brain regions back on, which tells the computer to allow the game to play. And all this is taking place in a blink of an eye, as you can see. So Andrew wants the game to run smoothly, and he keeps his brain turned on.
I try to get focused on the game, and I just get focused on the game, and I try to make the game start again.
I think medication has its place in the treatment of ADHD, but if neurofeedback will allow the brain to grow and develop normally, then that would be a better solution.
Now, Howard, what are your thoughts on the alternative therapies that are being used?
There's no doubt that there's a need for additional work to try and develop alternative therapies besides the ones that are there. However, the ones that are out there right now, one needs to take a very critical look at what they do and what they don't do. Parents have to be very educated consumers, and they need to pay attention to whether or not the evidence supports the claims of those folks who are promoting these treatments. And that really needs to come from very solid science, from very good controlled studies, and from results that appear in the professional peer-reviewed literature. That's not the case yet with these treatments.
Fair enough. For more information about ADHD, visit CHAD, that's Children and Adults with Attention Deficit Hyperactivity Disorder, and their phone number is 800-233-4050. And on the web, it's chad.org. And the American Academy of Child and Adolescent Psychiatry, and their phone number is 202-966-7300. And on the web, it's aacap.org. And I want to thank all of you for being on the show today and sharing your experiences and your vast knowledge about attention deficit hyperactivity disorder. We'll see you next time on Keeping Kids Healthy.
For more on today's topics, visit keepingkidshealthy.org.